I feel like the disabled community is like the most cutthroat community because they always challenge you. It's like, well, how disabled are you? Like, can you imagine if like you're in a different community, not the disabled community? Let's say you're in like the LGBT community. It's like, how many dicks do I need to suck to prove that I'm gay? The day that Jeremy reached out to me, I had a dream that I was on this podcast, and Jeremy was really mad at me because I had never had an IV before. I was like, what are you talking about? You don't know me. I've had an IV before.
I would not be mad about that.
But you've had one, right?
Yes, I've had a few, many.
You have? Okay, good. Good. Because
he was about to be pissed.
Yeah.
No, I wouldn't have been. All right, let's get into it. We are sitting with our new friend Kayla, and Kayla, you have something I've never heard of before. It's called Unilateral Anaphthalmia.
Close enough. It's unilateral anaphthalmia.
Anaphthalmia?
Yes.
I went there and picked apples last summer. Fuck, that's good. And you'll only get that joke if you're from Nova Scotia.
That is true. Yeah.
What?
It actually was. I mean, not to dwell on this, but
Yeah?
it was actually.
How do you like them apples?
It was pretty good.
Yeah. Okay, so Kayla, let's get down to it. Let's get serious for a fucking second, okay? Stop
Yes.
joking around, Kayla. Let's get serious. What a jokester. What is unilateral fuck? What's it called? God damn it.
Unilateral anaphthalmia. So basically what that means is I was born without an eye. It's
What?
a very rare
She said she was born without an eye.
Where? In your head?
Yeah. Wait,
Can you show us?
Can you do you haven't seen did you just think that she was just had her right eye closed the whole time?
Okay, yeah, it looks like you're just winking.
Yeah.
Yeah.
So a lot of people, including myself, forget that I have this condition because my eye is at full growth at this point, and I also wear glasses, which makes it hard to see. They're also transition lenses, so like it gets dark, you don't see the eyes in the first place, and then like there you go.
Yeah, Brad just thought you were just like really holding on to that one wink. Like,
That's such a good.
I thought you were
trick.
flirting with him.
Can you imagine if you were I mean, Kayla, this probably happens to you all the time. You meet somebody out in the sunshine and the transition lenses are in full effect. You know, you got your sunglasses on, and then you walk indoors and all of a sudden there's this slow reveal to the fact that you don't have an eye.
But again, I gotta say, it doesn't look like you don't have an eye. It really just looks like
Your eyes
like
closed.
like you just cut onions or something, and it only affected one side.
Yes, correct. So it is a chromosome disorder, as far as I understand. The gene responsible is called SOX2. And apparently, I did some research before I came on the show, like 20 minutes ago, that apparently 1 in 30,000 births in America have this condition, and it's a very rare condition. And not only that, this condition usually comes with several other birth defects, and like that's like a cluster of different disorders. I was just born lucky. The moment I was born, and the doctor had told my parents, don't expect much because she's gonna have like a lot of issues growing up because of this one condition right here.
Okay, so you come out, there's only one eye, and because of that one eye, which is because of this genetic issue or chromosomal issue, the expectation is that you're going to have all this slew of issues. I'm assuming when they say don't expect much, that's probably going to be like physical and cognitive
Correct.
issues that come along with that. But you know, given the fact that you still only have one eye, that in this realm is like lucky to just have the eye issue and not all this other stuff.
Correct. Yes. Yeah. So I was born extremely lucky. Like a lot of these conditions usually come with cognitive issues, heart defects, excess limbs, excess organs, like
Excess limbs?
maybe not limbs, but like organs and like just excess things that you don't need that could be lethal.
Excess organs.
Yes.
Interesting.
Like Like, what type of organs are you thinking?
Like
All.
Like
Any and all of them.
Like any. There's so many of them.
There's
But,
lots.
but like, I feel like that piqued your curiosity for a specific reason.
Well, I
Like,
was
you,
thinking
like,
about maybe someone was born with, missing a right eye but has 12 penises. That's kind of cool.
Yeah, I mean,
You know?
I mean, I'm guessing it's just like maybe one extra of something.
Let's play a little game of Would You Rather. No, just kidding, Kayla. I would never do that. One thing you did mention though when you were walking us through the unilateral anophthalmia was that you said your eye was at full growth or something. So like, is there anything this is gonna, I don't mean this to sound like the really mean thing that people will say where they go, is there fucking anything in there? Like, but like, is there,
But like, is there anything in there?
but is there anything in there? Yeah. Like, yeah.
Yeah, so a lot of conditions with anaphthalmia also come with another condition called microphthalmia, which means your eye is smaller than the average eye size. And I was born with that. And so I had a prosthetic spacer put in, which basically it like helps your face grow to the normal shape, essentially. And then,
Whoa.
yes, so in order to get a prosthetic eye, you need a spacer because the eye is going to be way too big for a really small hole.
Whoa. Okay. All right. Well, so here, how about take us back a little bit into your experience and obviously you probably don't remember coming out of the womb and having the doctors have this conversation with your parents where you were just like standing fucking right there. But I just for context, like, what do you recall from what your parents were told, how your parents felt, and then like, what was the immediate sort of aftermath? Was this sort of thing where, all right, like as an infant, you have to go through these corrective surgeries, or do you have to kind of wait until you're a little bit older?
So I actually learned something about bioethics a few years ago. And basically, like, a prosthetic eye is not really needed. It's kind of like having fake boobs. Because if you have a prosthetic eye, it's not going to tell the optic nerve to start working. It's just going to be there for aesthetic purposes. Except this was the 90s and things were a little bit different. And people believed that, well, you need to look a certain way to be respected. So the doctors had forced my parents to get a prosthetic piece because they wanted me to look a certain way. And so these surgeries were done without anesthesia. And
oh my God.
yes, because
Holy
at the time they believed that babies don't feel pain, and this is not gonna affect her
That's
in her
true.
later life. So
Oh my God.
yes, it was very traumatic. Well, I don't remember birth. I do remember quite a few of the surgeries.
Whoa.
and like, how old are we talking when you're having those surgeries?
We're talking, these surgeries started as early as 6 months to 10 years old.
Wow.
Well,
fuck.
so it was like so triggering that it just like turned you on to life, like not turned.
Yeah, I was like, what the fuck, Brian? What?
Not like,
Yeah.
not,
I mean,
But now I see what you're saying. It brought you online.
yeah, like
Yeah.
like like your earliest memory
Yeah.
has to be like sort of triggered by something because it has
Yeah.
to be memorable enough that
Yes.
you remember
Right,
it.
right.
And I mean that's bro science of how
You're
it
good.
works.
You're really blowing me
But,
away
like,
here, Bri.
but it like those surgeries for you, the earliest memories, like they were so traumatic and still sit with you now that you remember them to this day. Like, is that what you feel like are some of your first memories?
Yeah, I mean, like, that's like the closest thing to a first memory I do have. I can't think of anything earlier because, yeah, I focus a lot on the negative too. So, like,
Right.
a lot of my memories are
intentionally?
mostly negative. Huh?
Like intentionally?
Not intentionally. It's just like the first thing that pops to mind. It's like, oh, what is the first thing? What is the memory you have of your grandfather? I'll be like, not spending enough time with him.
Right.
That's just how my brain
His
works.
absence.
Right. I mean, like, serious question. Do you think that, and like, this may be speculative and like, I don't want to therapize you or anything, but do you think that mentality comes from this like, this like sensory trauma that you experienced early in life? It's like when we're children, like Taylor has 3 young girls, and they're like toddlers and infants, and like like what's just after a toddler, like
Baby.
No, but like
after?
the other way,
a child.
a child. So he has a child and a toddler and a baby, and so those, like, their innocence is what drives them.
At least the oldest did have that innocence until Jared played a very mean practical joke on him, where he stabbed a thing of milk. Actually,
don't tell this to Kayla.
This is Kayla. This is. I mean, Jared, you might as well.
Kayla, I'm so sorry.
You might as well. You might as well own it.
I pretended to poke my eye out, and I had a creamer for coffee, and it made it look like my eye was just like white juice that shot out, and she was scared. Okay, whatever, it doesn't matter.
And then she turned on. And
Kayla gets it. That's a funny joke. Kayla, you do the joke. You do it for us. Kayla just has a creamer in there
at all times. Just
ready
on hand, just ready for the
Sorry.
joke.
So what I was saying is children have this innocence, right? And like and because they don't know that the world is horrifically awful and that we're just bombing each other because of the color of our skin or the way that we like view a god with a capital G. And so for you, it's like that innocence in a way was almost like immediately stripped from you due to having these what I'm assuming are like very what's the word? Invasive surgeries.
Mm-hmm.
Like surgeries directly on your face, and like, I mean, you haven't even described the surgery, but you're talking about putting in spacers in, like, it just sounds horrific. Can you walk us through what these surgeries were?
Well, I don't remember them. That's the problem. So like, I just remember being held down at 2 years old by like one person on every limb while the doctor just shoves in this piece in my face. And like me screaming on the top of my lungs. My aunt recalls it being like almost.
Oh, gee. Whoa. Wow. Holy. Yeah. Wow. Goddamn. Well, there goes the YouTube monetization on this one. Just kidding. No one watches our YouTube.
I watch the YouTube.
Hey, there we go. Let's go.
I mean, it is like, it is crazy. Like when I've had, Zaya had a tongue and lip tie, which is like when their frenulum on your tongue and your lip goes down too far, and it can like basically mean that you can't like stick your tongue out quite far enough, or and the one on your lip, one on your lip can cause your a gap to form in your two front teeth. And so this all has like to do with like speech, like later in life. It's kind of like, and it's a bit of like a roll of the dice where they go, okay, there's this thing and it might not do anything. It might have zero impact at all. Or it could make this gap in the teeth and it could reduce the way that your tongue moves, which could lead to like lifelong speech impediments and impairments for speaking, which then have like all these other things. And so we were new parents and we're like, okay, well, like we'll have this thing done where they go in with this like little laser and they like snip it. And the snipping of those frenulums is not painful. But then after they have it done, you have to like massage it as the parent to make sure it doesn't just grow back right away.
I remember when you were doing this, yeah.
And I would have to do this to Zaya. Would have been 7 or 8 months old at the time. And they were like, hey, you have to basically like fold her lip up and like rub your thumb on the frenulum to avoid the tissue growing back too quickly. And you have to do this every 4 hours. And I was like, after probably a week of doing this, you're supposed to do it for 3 whole weeks, every 4 hours. I was like, if I keep doing this, I will not have a relationship with my daughter.
Yeah, right. Yeah.
Like she will, this will be such an embedded traumatic memory of the way that we interact with each other from this super young age where I could just feel like a visceral detestation of me as her dad because I had to do this all the time.
But you didn't think to like explain it to her what you were doing so that she would like
listen, it's bit? For your own good. Yeah. She wasn't quite online enough at that time.
Kayla, one thing I want to ask is about those surgeries. I mean, so you had told me you had 6 of them, and again, no anesthesia, which is fucking shocking. Was there? I mean, we're sitting here talking to you right now, and you don't have from at least looking through a screen here and looking through those transitional lenses, it doesn't look like you have a prosthetic eye. So were those surgeries, were they functional? Did they do anything? What was the result?
So it's a good thing that you asked, because like I honestly thought that they were falling out. Like they would glue the eye socket shut and then I just thought it would fall out. But my aunt recalls me pulling it out because I was in so much pain. So I would
so you pulled the prosthetic eye out.
Yes.
Whoa. Wow. Oh my goodness. And how old were you when you pulled it out?
So this happened between the ages of 6 months to 10 years old.
Wow. Oh my goodness.
That might be where the theory that kids don't experience pain comes from, where they have something done and then they fuck with it because and then going, oh well, the only reason they're fucking with it is because they don't feel pain. There must be. I pulled stitches out of my lip when I was 3 years old 3 times, and then my parents went, no, well, we're not going to.
It seems crazy because
we're not going to get it put in again because you're just going to pull it out.
My brain would assume that they can't tolerate discomfort more than like it's not painful. Like if you're pulling stitches out or you're pulling like a prosthetic eye out, like I would assume, again from the bro science perspective, that like the discomfort is so unbearable. And like
that you're like, I got to get
discomfort
this out of me.
in and of itself is a form of pain. And so like
we also say that lobsters don't feel pain, but whenever you drop them into a pot of boiling water alive, they screech and scream, which I'm sure a baby would too if you did that.
Before we get too far away from the point that Kayla had mentioned about your aunt said that it was like
God
like
damn it, Brian! Stop.
But I don't want to gloss over that.
Well, there goes all the other ads that
because like that is such a like intense way to describe that, and I feel like those words are obviously to some extent chosen to actually try to find a way to capture the intensity of that experience. And you said that your aunt described it that way.
Mm-hmm.
Like how do you think about that in your head, considering that you were actually the person to go through something like that?
I honestly agree with my aunt's statement. That's how I would describe it, because when we think about I keep saying it.
It's okay. Just say grape soda.
When we think about grape soda, we think about consent not being met. And if there's screaming, if there's crying, that means there is no consent. And doctors are forcing a piece of plastic or whatever the prosthetic is made out of into a small hole. It's going to be very painful. And then there's your grape soda right there.
Mm-hmm.
When you think with this case of your eye surgery, there's like this intent from these people who are, I don't want to say like are supposed to love you, but I assume your parents love you and they're doing this because they want what's best for you.
Mm-hmm.
How do you think of that in this situation where you're like, like I've had this recent discovery.
Brian's about to make this about his circumcision. Here we go.
In therapy where like you realize that your parents are actually just
they're just trying to figure out the best that they can, Yeah.
And so like they obviously like this is a very complex emotional situation, and navigate this feeling of being like, fuck, like I didn't have consent in this. I was like, went through this brutally traumatic experience. And then there's also this thing of like trying to manage this idea of like, are these people were doing this because they love me and they wanted what was best for me and this is what they thought was the right thing?
So I had a conversation with my parents about this because for years I had resented them because I thought, oh, they just wanted to meet beauty standards. They wanted me to look a certain way. But then they came forward telling me that they didn't feel that this was ethical and they were kind of like pushed on by the doctors to do this. And so they also have like secondhand trauma from witnessing me going through these surgeries.
How do you think that those experiences between, the ages of like 6 months to 10 years of age and going through all these procedures, How do you think that had an effect on the way that you see yourself?
So funny enough, like when I was growing up, I didn't think I looked different. I knew I had one eye, but I was like, yeah, I don't look very different. I could just pass off for anybody really. And like I would just like walk in and be like, all right, what's up? And be like, nothing's wrong with me. But like kids would like point and laugh at me, being like, why do you have no one eye? And like it really did damage on my psyche. And like I I started wearing my hair a certain way where it would like cover half of my face, like that really emo haircut. And like I was like, well, people don't like the way I look, so I'm just gonna do this with my hair. And yeah, that's how it really affected me since then.
Which was conveniently like a pretty good time to have that haircut.
Yeah,
too,
totally.
because,
Yeah,
like,
yeah.
I feel like it was a very probably especially in California, very
It's
very California emo.
There's always emo. There's always emos. There's always going to be an emo kid, you know, like the time doesn't matter.
I mean, I feel
emo
like
kids
I
when
was
we were
emo.
kids, emo kids when they still exist, you know. Do you feel like to that point, you know, you're walking around thinking, well, I don't feel like I look different. You have people going, you fucking look different, and pointing it out. Did you feel like a desire to almost find community in like the disabled community, or was there, because again, like that notion of like, well, I don't feel like I look different. I it sort of speaks to the sense of like imposter syndrome, where it's like, I'm not disabled enough to be disabled, but I'm also too, you know, I'm too different to be like everyone else, it seems, according to everyone else. How did that fuck with your head?
So the way that disability, at least in California, is recognized in schools is like they kind of group everybody together regardless of the issue. So whether you have hearing loss or cerebral palsy or a vision disorder, they're going to group you all together as one disabled person. And so as being grouped together, your needs are not really being met because like they have like this standardized version of teaching. Like I had to take remedial classes basically in elementary school because I do have a learning disability, but like I was still learning at a fairly normal rate compared to my disabled peers. So it almost felt like I was being held back. 'Cause I went to a special needs high school. That's where I graduated from, and I thought I was a genius because that's what the teachers were telling me, but I wasn't learning at the normal standard rate, because they group you all together.
That is, I mean, I even remember, I probably wouldn't have had this thought very consciously at the time because I don't know how thoughtful I was in high school.
But you weren't.
Like looking back on that, I can go, yes, I remember being like, there's all these kids that have what are they called? EAs, whatever the job title is of like
educator assistant,
people that like where like a student or a group
I always called them helpers.
Like they're like assigned to like a student or a group of students, and they're going to like classes with everyone else, but then they're also going to other classes as a group. And I remember being like, there's a really big difference between some of these kids. And like, it doesn't really click to me. Are they all going to the same class and being taught the same thing? Because like, I can see that, you know, kid A and kid B are definitely are not sharing the same disability, but they're going and getting the same type of teaching and education. And I mean, it's really just like a shame and I'm assuming it's like it stems from a resource problem
and also ignorance and also a failure to give a shit.
I think probably at a certain time ignorance, and now probably more resource where it's like we know that these people are not benefiting from getting
that ignorance still
type
exists.
of education.
I think part of it though too is like, you know, like it's sometimes easier to just make this like broad quote unquote fix where you're like, we're providing support to this group of people, but like they're not actually willing to go a layer deeper and understand like, is the broad average support actually effective for the different, types of groups that exist within this population? Like you could say at a, at like a school board level that like, oh, we provide support to people with disabilities. And like that feels good. And when you zoom out and look at it from that perspective, you're like, yeah, they have disability and teachers there.
I mean,
but when disability is so broad and there's so many different
like we've seen this, Kayla, with
like
talking to people who live with cerebral palsy, and cerebral palsy being a condition that may or may not have a cognitive impact, but basically being treated as if it definitely does. And kids without their cognition being impacted by cerebral palsy going, why the fuck are you talking to me that way?
Did you feel
I'm not like I don't have a learning thing.
when
you're
when
talking
you
to me like I'm,
when you graduated, did you like when you got out of high school, did you feel like ready to kind of take on the world, or were you like, fuck?
I was very heartbroken when I found out what the core curriculum was and how I was not learning at the same speed, because I was applying to these Ivy League schools not knowing what the core curriculum was. And like I became really depressed. It really started to take effect on my psyche, because I was like, I thought I was learning at a normal human rate, and now I'm being told that it's all a lie.
And what were you applying for? Like what were your aspirations when you were like, I'm gonna go to university?
I wanted to be a film director. I was applying to Barnard, Chapman, like all these big film schools, basically. And I just could not get in because my grades were not the core curriculum.
And then, after making that sort of harsh realization, what was plan B? What did it look like after that first step that you couldn't even take the step because in front of you was just this ocean that was kind of forced upon you?
So thankfully, 2-year colleges exist. So what is it called? Community college exists. And to get into a 4-year, sometimes you have to go to a 2-year because they'll say, oh, you're a college literate, you can do the work. Except I started to realize that the resource center wasn't resourceful either, because again, they would cater to disabled people, and I would walk in being like, hey, do you have any books on tape or audiobooks, because like I learn audibly? And they're like, well, we have this program, but you can only use it on the disability program's computers, and you can't use it at home, which makes sense. But at the same time, like I'd have to like spend hours in one room, and it didn't seem necessary. Like this was 2014, so like text-to-speech was like in its infant stages. And so like we didn't really have Audible, we didn't have all these sources for books on tape or Audible at the time. So it was, and also the program that they had, it was this very robotic voice, and like if you ever listen to a robot speak for more than 15 seconds, it kind of drains on you, where it's like, are you even accessing this information? So I kind of felt from these resource centers that I was not disabled enough because they just did not have the resources to cater to me.
Interesting. And so I mean, you're 30 now, and this is obviously something you've been like navigating your entire life. Do you feel like, how do you feel today about speaking about your disability, kind of like, advocating for yourself, trying to express the needs that you have, or the sort of like accessibility needs, or like special what's the word I'm looking for? Like accommodations for certain things. Like, do you find that that's an easy or a hard road to navigate, considering you're in this sort of like gray zone? It seems like, every time we come into this sort of situation.
Yeah, so it's hard because I don't use a lot of disability services. Like, In fact, like on my computer, the only thing I use is the text-to-speech feature, and I can zoom in, and that's really all I need because a lot of resource designers just tell me you're not disabled enough. Like, I feel like the disabled community is like the most cutthroat community because they always challenge you. It's like, well, how disabled are you? Like, can you imagine if like you're like in a different community, not the disabled community? Let's say you're in like in the LGBT community. It's like, how many dicks do I need to suck to prove that I'm gay?
That's actually a really fascinating question. I actually don't know the answer to that.
I think it's all about intent. It's like, I mean, like,
I think it's open ended.
I think it's whatever you say it is.
Exactly.
Like, yeah. I mean, it is a really great analogy. And one of the things that I find, well, I'll ask you, I'm curious, like, where do you find that this is a sentiment that you're hearing from, like, be it like online communities or through, I know that you're an aspiring, YouTuber and content creator. So like, are you seeing this in like comment sections? Like where do you feel like you're hearing this sentiment where you are, being questioned or challenged on like how disabled you actually are?
So funny enough, I don't see a lot of people talking about it. And the only people that I've seen talk about it is actually guests on the show in the past, which is why I reached out, because I think it needs to be talked on more. Like, I remember the I Identify as Blind episode where the speaker was saying that she was being, like, told that she wasn't disabled enough. Or there was the Mitch guy who did the Maid episode who was, like, complaining about the right to die and not being disabled enough.
Yeah. I mean, it is. I guess it is a really like common thing, especially when we're talking about things that aren't like, like the very evident things where it's like, oh, that person uses a wheelchair every single day to like get from A to B.
You know what the interesting thing is though, and maybe this is like, I'm just trying to understand like why, like where this could come from and like how that could be true, because it is like, it's a bit, even for me who has talked to these people like Mitch and many others who have mentioned this, it's hard to like really understand how the community can feel like it's hard to be accepted into. But something that's interesting is with the Paralympics, when you want to compete in the Paralympics, I believe all the sports, maybe some specific ones, have the classifying system where in order to compete, you have to be classified to assess like how disabled
are you?
And
Right.
and the reason why in sport is to create a fair playing field.
Right.
Like that's the stated.
How disabled are
goals.
you? How many dicks have you sucked?
Yeah, I mean,
fucking sorry. That's
Well,
from
like,
sorry. I'm looking at the wrong.
So that somebody
qualification.
with a disability is competing against somebody who has a relatively similar, is relatively similarly affected by their disability.
Yeah, and so the idea is that we as a society are taught to think that way to make sure that we're creating a fair and equal playing field. And so like with disability, like access to resources, we know that there's not enough resources already for the disabled community. And so maybe people in the community feel protective of the little support that they get.
Right.
And so like there's this like unconscious bias to be like, well, are you really one of us? Like,
are you going to come in and like take away, like use the resources that I depend on when you've got that disability and I've got this disability?
Yeah, and Kayla, you've been like pulled and pushed back and forth on that line so much.
Which team do you want to be on the most?
but like the points that you brought up earlier of like, like maybe I shouldn't have been in those classes. Like that wasn't for me. But then it's also like, but then when I need access to that stuff, I'm not actually getting the right, level of support that I need. Like, how does that feel as someone who's sort of on both sides of the spectrum there?
It kind of feels like that I am, like, it feels like I am a part of a group of children that were forgotten about, basically. Like, you've heard of Nobody Left Behind. Well, I was definitely left behind because the resources weren't there. The resources that they did have were very limited to more severe disabilities, and I just did not feel the mold. And I couldn't blend in with able-bodied children because I just looked different.
What are the, you have, and I realize that when we're speaking with somebody who has been living with something from the time that they were born, it's like all you know is having one eye. So like, I would assume your general outlook is like, I see the way that I see. But when you have living with one eye, like what are the challenges or the way that you see the world, literally and figuratively?
You're trying to classify, Kayla?
that crop up as challenges as a result of having one eye.
Yeah, so funny enough, like when I was growing up, I didn't have that many challenges. Like I didn't walk with a cane, I didn't walk with special sunglasses, so like I really didn't identify as a visually impaired person. But then like if you notice my fine motor skills, they were not up to speed to a able-bodied person. And before I came on the show, I did I was watching a presentation of how motor skills and visual impairments are correlated. And, like, we learn things osmosisly sometimes. Like, we watch people do something and then we learn it. But, like, for someone who's visually disabled, that skill could be impaired somehow. And so I didn't learn how to tie my shoe. I can't cut meat. I can't I can't thread a needle. Like, so, like, those are the only things that really impacted me.
So you can't cut meat?
No.
Is there like something specific about meat versus like vegetables or something like that? Or like you can't...
I mean, I can't cut in general. Like when I cut things, it looks like I'm trying to stab it and like move my hand back and forth and be like, "Is this cutting?" But like that's just the way I learned.
Is it like is it a depth thing? Like threading the needle? I mean, I would assume if I covered one eye and tried to, I mean, fuck, I can barely thread a needle with two eyes. If I covered one eye, I'd probably have a really tough time getting the thread to meet the eyelet of the needle. Like, is it because with one eye your depth is, and again this feels dumb to ask because like you don't know the world with two eyes. So like I've realized that this is kind of stupid, but like that the depth is thrown off because you have one eye, and that makes a slew of things like just more challenging for you to do.
Yeah, it's definitely a depth thing, and it's also a motor thing just because my hands just don't move the regular way that an able-bodied person can. Because like when you think to tie your shoes, you like the two loops, cross them together, and like then like you go under. But like I'll do that.
Oh,
but
that's your problem right there. You're trying to tie bunny ears. Don't fucking do that. That's stupid.
Or get Velcro.
You can't be tying your shoes bunny ears. I mean, anybody who does that must be disabled.
But that makes sense, Kayla. Actually, like I've never thought of this, but I guess like the feeling for me of knowing how to tie my shoes and do that with my hands only came because I was able to like watch myself do it and understand what that felt like. And so like cutting anything, I am looking at the depth and I can obviously see and my hands are following. But the only reason I know where my hands are and can move them so well is because I learned where they are. And also think about like the depth,
the level of instruction that you get. And thinking of this from like, I'm thinking about this from the perspective of like being a dad and teaching my kids to do stuff. And like the instruction that you're giving is only a certain layer of what you need to do because you're working under the assumption that they can also see you in this certain way. So it's them putting together the words that I'm speaking in conjunction with like the actions that I am making. And I don't have to describe every little detail because I'm showing you and telling you. So if you can't quite see that in the same way, then the words, and this kind of goes back to, I think, to a little bit of what you said earlier, Kayla, about like being able to get access to audio recordings of things, because like, you know, reading something might just be like, just too challenging in certain ways, that like the level of instruction that you need to give verbally needs to be different and probably a lot more enhanced when the ability to watch and see the way that something's being performed is limited.
You say you can't cut meat, but can you cut the cheese?
Yes, I can.
That was a great one.
Nice. Fuck
We're
yeah.
How
super-
stinky are we talking?
Super stoked that came. out.
I want to know. I mean, so we were talking earlier about I was going to say something that I know I definitely would have to cut out. I was going to say, speaking of sucking dicks, let's just make a note there.
Should we cut all the sucking dick things out of this?
No. How has your experience in navigating this disability and also the way that you've navigated like your social situations in life, how has this affected dating and like that side of things and romance and like, is this, are you trying to date? Is it something that you've struggled with? Is it something that you're like, oh, it's not even something I really think about?
So yes, dating is possible. I just choose not to do it because I'm in a really dark place right now. Like, dating is just not an option. But like, if I was in a better headspace, I have been basically avoided that I have a disability. Like, I don't tell people don't notice, and I also forget. And like, I had one partner, it took him like 3 dates to realize that I was missing an eye. And
Right.
like,
Fuck, was he missing an eye?
huh?
Was he also missing an eye?
No,
No.
he thought what you thought, Brian. He thought she was flirting with him.
Like, it took him because like, I cannot see long distances, and like, he was pointing at something and I was like, I can't see it. And then that's when he realized, oh, she has one eye. And I was like, wow, it took him 3 dates to notice that. And like, as a kid, I used to draw self-portraits a lot, and I was always drawing myself with 2 eyes because I basically just blended in with the 2-eyed crowd.
I didn't notice, like, when we came on the call, and obviously we're looking at each other through a video screen, but like, it wasn't obvious to me, and I didn't think anything of it until you brought it up. But do people not notice often, or how do you feel about that?
So I think what happened was that because my eye's now in full growth, people just don't realize that I don't have an eye, because I was at the doctor the other day, and like, I've seen this internist about like 3 or 4 times already. She walks in, she's like, is there something wrong with your eye? I was like, there's always been something wrong with my eye, and this is the first time you're noticing.
Yeah, she's
don't
like,
trip
did you mistake your eyedropper for just super glue? What's going on here? It's just like, why open that eye?
I mean, the only people that really notice people is people that are highly observant and children, because children are like just normally really rude. They're the ones asking me the hard-hitting questions, and like, they'll be like, oh, what happened to your eye? And I'll look at them and be like, what happened to your eye?
I would say too, there's also like so like the folks that aren't watching on YouTube, which is everybody except you, Kayla, is that you're wearing glasses, right? And so you do have the benefit too of like, glasses carry that glare that, like, again, even if you took the glasses off, it's not like a whoa shit, what happened there? So you have the glare, and so it really is just very subtle. It's like you have to be like really looking to go, oh, there's something going on there. I would love to talk about your aspirations to be like an internet personality. I know you have a YouTube channel and you're making content, which is really cool. How does that play into the I guess like the catharsis of dealing with or managing a disability, or does it at all? Like, does your content, do you use it as a sort of source of catharsis, or source of working through the things that you've struggled with throughout your life?
Yeah, so my channel, as of right now, I'm focused on an audiobook that I am currently writing, and the main character is a self-insert, where I do briefly touch on the disability, but it's not a major plot point because there's like a whole overarching plot, but I do touch on it briefly. And also, I used to be the one person behind the scenes crew. Like, I work with a ton of voice actors, but I do all the directing, the editing, the promotions. And like I started to notice as of recent that the quality in videos has started to decline because my vision is also declining in my good eye.
Oh.
I was never able to see symmetry, but it was just getting progressively worse because I would spend hours looking at a screen trying to make sure that all the subtitles matched up to everything. But like the lines, it felt like they were blurring together. And I just could not see. So what I'm trying to do is I'm trying to expand my creative team to include video editors as well. Like I'll do like the base edit and do like all the visuals, but like in terms of adding the subtitles in a linear format, that will be someone else's job because I can't do it anymore.
How do you notice over time? How do you notice over time that the vision in your good eye changes? Like how long between when you think it actually changed to the time you go, oh, it's changing? Like what's the gap between those two things?
I think if you start questioning reality, then that's when your vision starts to change because I didn't realize my good eye was starting to, I don't want to say fail because it's still working, but it's not working to the same level it used to. So I'm just going to say failing for lack of a better word. I didn't realize my eyesight was failing until 2 or 3 years ago. I was in the hospital for something completely unrelated, and the doctor would come in, explain what's going on, but I'd be so high on morphine, I wouldn't catch a word he was saying. So what I would do when I was sober is I would go on my chart and read the notes and spend hours researching every word because they speak in this technical jargon that nobody's supposed to understand. And
Amen.
I started to notice that my vision was my eyes were starting to hurt because I was reading so much. And then afterwards, like I would read something and then the lines wouldn't look like words. They would just look like blurry black dots. And I'd have to like increase the font size to not just 12 anymore, but probably about 16 to 18.
Kayla, what would you say is, well, before I ask the question the final question that we typically ask our guests, what is like day to day for you with the condition that you have? Is there any sort of there any sort of treatments or therapies or anything that you have to like do on a daily basis, or is it just kind of like, you just live day by day and cross your fingers that one eye you got just keeps on fucking chugging?
I mean, this is gonna be a really boring response, but it's the second option. Like my life is pretty mundane. I'm not doing any occupational therapy. I kind of outgrew it after a certain age, and like even though like I wasn't meeting the check marks for tying shoes, like I met the check marks for everything else. They were like, oh well, she just doesn't want to learn, so we'll just omit that score and just graduate her from the program.
Yeah.
But like other than that, like my life is pretty boring. I get up, go to the bathroom by myself, eat pretty normally, do whatever able-bodied people do.
That sounds like my life.
Yeah.
Still going to the bathroom by myself. Thank God.
Thank goodness.
One thing I will say and I don't mean to laugh. I'm saying this and I'm laughing with you. But there is something very ironic and hilarious about having a conversation with someone who has only one eye and like fears that one eye is kind of like getting worse when and I'm assuming this is happening because you don't actually see how you're framed up right now, but you're just like totally out of the frame, which is fucking so funny. It's just like we could just see like half of your face. And you're like, I hope this eye just like does well. It's like, oh man, oh fuck, oh god,
I don't know, Kayla.
I think she's struggling, guys.
You see us?
I mean, I see you. I just don't see me. So I see a still image of me. I'm like, why is that frozen? Should I fix that?
Oh my goodness, I should have brought it up to show you what it looked like. It was pretty funny. Kayla, what's the biggest thing that you would say that I'm going to try to say it again. Unilateral anaphthalmia has taken away from you?
I feel that is taken away the resources that are available to most disabled children. So, like, not only am I born with a disability, I am born with a medical anomaly, things that aren't really, there isn't much literature on. So there's not enough studies to study this condition. So we don't know what resources are really needed. And I feel that because I was born with this medical anomaly, there just isn't enough resources for my specific needs.
What would you say is the biggest thing that it's given you?
The biggest thing it's given me is the able-bodied life. Like, I could just pass off as an able-bodied person and just get away with it.
Get away with it. What would you say is the biggest thing that you've gotten away with being a sneaky, not so able-bodied person, able-bodied person?
So I used to be really insecure dating when I was in high school. Like, back in the day, we had something called Yahoo Answers Everybody. And it was basically like you asked a question and then the community would answer for you. Like, the question I asked would you ever date a disabled woman? And, like, all the answers were, like, really jokey, very rude, and, like, it made me feel lesser. And I was like, oh, I don't know if I'm able to date. But then, like, as my eye grew to regular size, I was starting to pass off as just a regular woman. Like, barely any dating candidates even asked me that until many dates on. It's not something I like discussing on the first date just because it's a very traumatic subject, but, like, at least they're aware of it.
Yeah, right, right. Yeah, I'll fuck you on the first date, but don't ask about my eye. Said like a true disabled woman passing as an able-bodied person. Kayla, you're an absolute delight to sit and talk with. I'm so glad that you applied to be on the show, but also just like glad that you're pushing through regardless of the cards that you were dealt early in life. And if there's anyone who wants to follow along with your journey and the work that you do and the content you create, how can people find you? How can people stay up to date with all your work?
Yes, so you can find me on YouTube. My account is called EdgeLordess, EdgeLordess.
That sounds NSFW.
That does sound NSFW.
It's also such a sick tag.
Yeah, totally.
EdgeLordess.
I'm changing my Gran
it,
Turismo to EdgeLordess when I go home.
Yeah, so I make content on YouTube. You can also find me on SoundCloud, Kayla LeVay, where I post similar content, sometimes spicy content, but yeah.
Whoa, like what type of spicy?
Hey man, I think I called it. I think I was like, that sounds NSFW. What do you mean spicy content? Like what are we talking?
Spicy audiobooks, essentially.
Oh, okay. Like all right, fan fiction type shit?
Yeah.
Ooh.
Have you watched Heated Rivalry yet?
Have I watched what?
Heated Rivalry?
No, I haven't.
All right, well.
Did that come up just because we were talking about sucking dicks earlier?
No, spicy content.
Yeah, I guess, yeah.
Also originally started as a book, but
yeah, right.
Well, that's right. It's hockey smut.
I don't know not much about it other than there's probably a lot of dicks getting sucked, right?
what
In
It's like
Heated Rivalry,
hot hockey.
yeah, it's very much
hockey.
it's
Sexy
erotic.
hockey time.
It's homosexual erotic hocky literature.
Yeah, right. What's the spicy fit? Like, are you doing like Pokemon like sexy Pokemon fan fiction? Are we talking more like Harry Potter fan fiction, or what, or some sort of like Persona 5 fan fiction? Like,
So
what do we got?
So my spicy fan fiction is actually a crossover with 18 different fandoms. We have everything from Harry Potter, Naruto, Genshin Impact, Pirates of the Caribbean, Lord of the Rings,
Sick.
to name a few.
Brian's rock hard right now.
yeah.
Well,
Yeah.
we'll
I'm gonna go jack my sparrow later.
Oh,
That was a good one. That was a good one.
nice. Well, Kayla, thank you. You are just so fun to hang out with, and we really appreciate this chat.
Yeah, thank you.